So the next leg is what we now call prostate test. They are questionable, they are unprofitable, they cannot be validated. What do we mean by saying that? How many of them anyway? We have the one that is called prostate scan. Prostate scan, ultrasound. We have the one that is called prostate PSA tests. We also have the one that is called prostate biopsy. That is the three main tests. Start with prostate scan. Why do I start with it? Because that one seems to have some validity. It seems to have some rationale. That somebody whose prostate is enlarged has a problem. Even though in naturopathic medicine we see it as a marker, because most of the people who have enlarged prostate also have an enlarged BP. They also have sugar level problem. They have cholesterol problem. So we factor it into metabolic derangement and start using it as a marker. That is prostate ultrasound scan. Hear me now. That ultrasound is to assess the side. What do you mean by that? The urologists have put their heads together and determine what a normal prostate should be. I don't know how they arrived at it. The size, the volume, the weight. So, and they came around the cabal system because they sit down on their own and take the decision. They are right, they are not right, it's not really the issue. So if the prostate is between 20 and 25 cl or G, it is normal. If it is up to 30, then it's enlarged. If it is up to 80 gram or 80 mil, that means it is grossly enlarged. It's based on this one that they now come up with this rationale to tell you that you have enlarged prostate, you don't have enlarged prostate, and so. So the volume and other things are there. But does it say catch? And the urologists also tell us, many men, I'm quoting their website, many men with even grossly enlarged prostate may not have any symptom, while many men with normal prostate show lots of symptoms. Then why are you testing it? If they say that a malaria test, will you take it? That people who don't have malaria also have this thing, and the people with malaria also, so we treat malaria. Does it make sense that there's something wrong about it? Wrong prostate test, which cause great harm. We have just talked of the first wrong test, which is prostate scan. But we quickly go to the second one, which is called PSA test. PSA test, very important, very important, because this is where they rope people together. This is why they catch people together, and this is why they send many people to kingdom come. Your PSA is high. Your PSA is high. So, what is PSA test? The urologists in America say it is on their website. It's in the official catechism which they show people. They said prostate, which is prostate specific antigen analysis. We are blood for prostate specific antigen, a substance produced by your prostate gland. What it is analyzing is not bacteria, it's not a disease, it's a normal thing that every normal person needs to have in his prostate gland. In fact, if you don't have PSA at all, then you are not a man. Why does somebody want to analyze to find out whether somebody has it? It is believed. Remember I told you the cabal that run these pressure groups are like religious people. Belief is what sustains religion. It is believed that cancer may be present. They said this thing 30 or 40 years ago. Up to now, quote me now, nobody has proved it. The higher PSA level is because there's cancer. And I'm going to show you that. But it is belief. It is belief. They rope all the people who didn't have BPH into it by this one, by a test which they customized. But is this thing rational? Does it make sense? Does PSA test worth the effort? Does it solve any problem? Can it be rational? No. How many times did I say it? 3 times. And I will verify it for you now. I made copious notes on it because it's so important. If we can discourage PSA tests, many lives will be saved. Who are the main people that said it? United States Preventive Service Task Force said it. Who are they? They are the NAFDAC in America. They are the people who formulate medical tests and then congregate it and give it in bulk ways for the whole world to follow. It is these people that also tell us what BP reading should be, what cholesterol test should be, what malaria test will do. They are the ones that registered PSA test in 1990 when the urologists invented the machine to test it. They recognized it and then gave it out for people to be doing. From that 1990, the business opened. But what did they say in 2012, after 20 years? They said, for men of any age, the US registrar recommends that doctors and patients do not use PSA test to screen for prostate cancer because the potential benefits do not outweigh the harm. The potential good evidence shows that PSA-based screening can cause harm, including pain and many other things. So they effectively banned it in 2012, so much so that insurance companies were no longer paying when you are doing prostate tests. And the prostate test started good. In fact, you could be arrested in America for doing prostate tests in those cases. Are they the only people who said it? No! Look at this one. National Cancer Institute of USA. There is no specific normal or abnormal PSA level. In addition, various factors such as inflammation, prostate can cause a man's PSA level to fluctuate. It is also common for PSA values to vary somewhat from laboratory to laboratory. Consequently, one abnormal PSA test result does not necessarily indicate the need for the prostate biopsy. Look at what Professor Amblin said about the PSA, who got him a Nobel Prize because he knows about PSA more than any other person. He said the test, PSA test, is hardly more effective than a coin toss. He said the problem with PSA test is that there are too many false negatives. What does that mean? Up to 80% really. That means the score indicates there may be a problem when there's none. Look at the book Professor Amblin wrote, which he called The Great Prostate Hoax. How big medicine hijacked the PSA test and caused a public health disaster. But the one that made the most another striking thing about this Professor Emeritus of Medicine, Dr. Steve Savage. He said the false positive rate of PSA testing is as high as 80%. Did you hear that? The false positive is as high as 80%. In other words, if your doctor tells you that your PSA test was positive, there is an 80% chance that you do not have any cancer. Nobody has contradicted this one. But before I leave PSA, look at me now. This is very important. When these people did what they did and banned prostate in 2012, then their market started falling. The market started falling. Nobody was coming for the disease. Nobody was testing it again. Then they became alarmed. They started lobbying. They started crying. I don't know whether they bribed people also. But what happened is that after 5 years, these people gave a little waiver. If they didn't open the door or the window, maybe they opened the chimney for them. What did they say? That physicians should discuss this PSA potential benefit with its obvious harms. They should discuss about the potential harm. What is the potential harm of this thing? A patient will sit and tell them, this thing is a coin toss. It may or may not mean anything. Will any of us say it? You know it is not. Will they say that? Don't go to do PSA because it does not mean anything. The man who created the people who are about to say it does not work. If you don't know, you will still die. What you don't know will kill you. What is the next one? That one is called prostate biopsy. Prostate biopsy. PSA test can harm your pocket, but it will not harm you. Because it's just to take blood from you, and the type of blood they take for maybe sugar test or many other things, or pregnancy test, and you go home with less money in your pocket. But it is PSA test that recommends you to biopsy. In fact, prostate biopsy goes right on top of PSA, just as the tomorrow's morning is riding on today's night. But there's even a grievous parallel here. Why PSA it can be accommodated, the biopsy can kill because of the way it is conducted, because of the way it is done. I will show you now. It is like a pistol. Look at it. They shoot it through somebody's anus, pass through many layers of skin to the prostate, and collect many meat there, many flesh there, and bring all this out from a living man's prostate and go and test for something that shouldn't be tested at all. Risks associated with prostate biopsy include, are you seeing it? Bleeding at the biopsy site. Rectal bleeding is common after a biopsy. Blood in your semen, that is the sperm. Blood in your urine. Difficulty urinating. Infection. Prostate biopsy cause infection of the urinary tract of the prostate. There is infection, so it causes infection of the urinary tract. Complications from prostate biopsies, you see now, are common, and it happens in more than 15% of all cases. But the grievous killer in this type of thing, if you wouldn't mind me using the term, is what now happens when the tests have been completed. Is the treating time now. Is now the treatment angle of this thing that is the problem. We can't exhaust everything today. But as I'm going, I will leave you with something the Chinese said. They say if you want to know the road ahead, ask people who are coming back from that road. If you want to know the road ahead, ask people who are coming back. When it comes to what I'm telling you, I've been in that road for a long time. I suffered prostate. What they told me was prostate when I was still 55 years. I'm 73 now. Treated it for about 10 years. If I found out, most of them was not caused by prostate. I now face the thing that caused it and cured it. If we come the next time, we are going to major on this one. Wrong prostate drug and wrong unneeded prostate surgery also cause great harm. Thank you very much. I remain your guest, Dr. Ignatius O'Connor. Thank you.